sweetie. You're a good girl. Miss Lily, you ready? Happy Friday, Baylor College of Medicine and friends of Baylor. My sister's been at it again. She says it's time for another QA, so it's time for another QA. But beforehand, let me summarize what's going on in the world of COVID. Not a lot much has really changed. Cases and hospitalizations are pretty stable. There's some increase in case numbers, as you can see here from the heat map, in the southwest United States and in New York. The biggest concern I have really is if you look at the percent of the population that is vaccinated. The southeast is the lowest. So we're sitting around in a very unpredictable position where we don't have a lot of disease right now, but I think as winter comes along and our wastewater data indicates we're getting more and more virus, I think we're going to see that we're going to have an outbreak of COVID, or at least a surge in COVID as the holidays progress. And nationally, the wastewater data is also pretty consistent. The overall viral burden in the country is going up for COVID, so as it is in the city of Houston, as you can see. So I think we're, in the next several weeks to a month, we're going to see more and more cases. But I want to put that in context of the questions we're going to have, because it'll come up in some of the questions I was asked. So the first question I got was, does the ability to detect COVID levels in wastewater mean it can also be detected directly from human waste? Yes, that's how it gets there. It's excreted in human feces, and it's also, it's excreted in the urine as well. So that's why wastewater is a good indication of the overall burden of virus in the community. When we do that, it doesn't tell you how many cases, it just tells you the overall burden. So in theory, a fewer number of people who have higher viral loads could be responsible for increasing amounts of virus in the community, but most likely it's increasing number of individuals. Does the booster reduce the chances for the development of long COVID in those who get COVID in spite of the booster? Interesting question. There's plenty of data that showed, and we've gone over this, that vaccination, one vaccination and two vaccinations definitely reduces the complication of long COVID. There's some suggestive evidence that boosters also do that, but frankly, there's no real data yet that shows that multiple boosters prevent long COVID, although it's likely to. I certainly would get boosted and have gotten boosted. A friend of mine has COVID, called her physician, and he would not prescribe Paxlovid. He said the drug can cause kidney failure, and he wanted to do a kidney test first. Is this a true concern? Actually, it's a concern, but for the wrong reason. So Paxlovid is metabolized by the cytochrome P450 system of the liver, and so it's not excreted by the kidney. So unless you have really serious kidney disease, there's no reason for you not to take Paxlovid. Now, the Pfizer recommendation is if you have very severe end-stage renal failure, not to take Paxlovid or dose adjust it, because they haven't done enough studies. They don't know what the impact would be if you have chronic renal insufficiency and chronic kidney disease, whether Paxlovid would be a dosing problem or there might be other complications. But in general, in normal people, if you're filed with even modest renal insufficiency, they recommend, there's no contraindication for Paxlovid. So I'm not sure why your doctor said that. Here's a good one. I love this one, actually, because there's a little anger in this one. I cooked food for my elderly patients, and the next day, before delivering food, I got symptomatic and I tested positive for COVID. Should I throw the food away? Could she be infected through the food I prepared? So no, you shouldn't throw the food away. I'm sorry you got COVID. But remember, we went through the data. There's been, especially cooked food, there's no evidence yet that transmission through bags or deliveries or groceries or anything causes COVID, and especially if it's been sitting away from you for 24 hours. There's no reason not to give the food. Now, there's a reason for you not to go visit them, but somebody else can deliver the food. My 12-year-old granddaughter got a flu shot on November 5th, and then she got the flu on November 12th. That's bad luck. How long should she wait to get a booster for COVID? Well, the first thing is, remember when you get a shot for flu, it takes 4 to 6 weeks to get an immune response. So many people are getting the flu even though they got a recent flu shot because the flu season is so early. Usually it's not until November, December, but it's been September, October. So that's why people are getting infected. And what we usually tell people is, as soon as she's feeling better, she should go ahead and go get the COVID vaccine. So I'm glad you're thinking about getting her boosted, and please do. This is a question. RSV has always been a concern mentioned to parents and watched by pediatricians after the birth of a child. What is causing the increased RSV cases and deaths recently? So a couple of weeks ago, we had Dr. Munoz on, who is an outstanding RSV expert. And we talked about this, in case you want to go back and look at that one. And we think likely what's happened is because of these past 2 years with all of the social distancing, wearing masks, most of the respiratory diseases, even in kids, went to almost nothing. We had almost no flu the last 2 years. Also the same for RSV, which leaves a whole susceptible population who have not been infected, who normally would have been infected and recovered, but are now all, not infected and susceptible to RSV. And I think that's why we're seeing such a huge big increase in the numbers of RSV. Can you address whether the rise of SARS-CoV-2 subvariants will change the efficacy of the bivalent boosters? A really good question. I had COVID in early June and then prioritized getting a flu shot before the new COVID booster based on local data. Now I'm wondering if the newest booster is really worth it. Well, the answer is it should be, because all of the variants are of Omicron, and the new bivalent booster includes a BA.5 antigen. So I would go ahead and do it. There's not a ton of data yet on that because all these variants are showing up relatively new, but it should be better protective, and a booster will help anyway. So I would definitely go ahead and get the bivalent booster. So this is a good one. How do you clinically differentiate between viruses like flu, RSV, or COVID? So honestly, you really can't distinguish. You need to be tested for them. There are tests for each of them, so if you go in and get tested, you can tell which one it is. In general, these are sort of generalizations. With COVID, there was that thing with losing taste and smell. That doesn't happen with the other viruses, so you're more likely to have COVID if that's the issue. RSV tends to affect the lower pulmonary tract, particularly in young kids, so maybe more wheezing, but basically clinically you can't distinguish them. So the best thing is to get tested. Can your child have more than one virus at a time? It's unusual, but in theory it's possible. When you get a viral infection, your body responds by secreting a bunch of factors that tend to interfere with other viruses infecting you, but it's possible. It's certainly possible. I wonder if a lot of people aren't boosted at the time because they're waiting for their natural immunity time period to be up. They tell you to wait about 2 months if you're infected, and many people were infected a few months ago. Well, the timing is unclear. We know that your immunity wanes, and it wanes after about 6 months. And so what we've been telling people is, between 4 and 6 months after your last vaccine, just go ahead and get the bivalent booster. I don't know why people aren't getting boosted, but we're not doing a good job. I showed you the data, only 10% in the United States have gotten their booster, and that leaves a very large number of people susceptible. Question, you think you have a cold, runny nose and sneezing, no fever, but after 3 days you test positive for COVID. What protocol should you follow? Well, it's good. I'm glad you tested, because one of the things we're saying is, you can't really tell, but if you have upper respiratory symptoms, probably a good idea. What I would suggest is you take Paxlovid if you're eligible for Paxlovid. Otherwise, we've said this all along, isolate yourself for about 5 days. And personally, I think it's best to sort of test yourself and be negative before you start interacting with people, because, or wear a mask. That's the other option. But in general, I'd say isolate for 5 days, then wear a mask or test negative. Any advice on how a parent or caretaker can help keep themselves well enough to care for their sick child and continue to work? Is that possible? Good luck with that. No, this is the big trouble everyone's struggling with. If you have young kids at home and they're all infectious with everything, but the best way to protect yourself is get vaccinated. That is the single best thing you can do. Get vaccinated for the flu, be up to date on your COVID vaccines, get the bivalent COVID vaccine. That's the best thing you can do to try and keep yourself from getting infected. This is a good one. Are masks effective in preventing flu and RSV, along with COVID? Well, there have been a ton of studies. There have been some studies on flu, but if you look back on it the last 2 years, I think it's pretty clear masking and social distancing was very effective at preventing flu and RSV. So I think we have the information available by just looking at what's happened in the last 2 years. Here's a good one. Some people are getting COVID more than once. Do you think there will be a time when COVID goes away for good? It's possible that could happen, but it's going to take global immunity. So If we have enough people who are immune to COVID, then eventually it could die out. An interesting parallel, we talked about flu last week with Dr. Piedra. You know, there's mostly the two strains of A and the two strains of B that were in the vaccine. But the B influenza, particularly the Yamagata strain, is not really circulating these days. And so it is possible that because of 2 years of not having much flu in the world, that the Yamagata B strain of influenza may be gone. We'll have to wait and see. But there's a good example where broad enough immunity and suppression of the virus can have it disappear. Another question. For some people, it's been a year since their last COVID vaccine. Is it still effective? Especially since there are a lot of people getting COVID with all these vaccines in place, including the booster. Are there any plans for yearly vaccine like the flu? Will we need COVID boosters or annual boosters? So, you know, I've mentioned this before. Your immunity wanes over the 6 months, even if you were infected. And so my guess is we're going to be getting vaccinations at least every 6 months to a year. My guess is we'll have an annual booster for the next several years. Here's one on flu. How effective is this year's flu vaccine? Well, we talked about it last week with Dr. Piedra. It's actually a perfect match this year, so we're lucky on that. Do we need to start wearing masks again with all these viruses going around? Well, you know, they work. So that's the main thing to think. So in your own personal situation, you know, most of the time you don't need to be masking in the community right now because we have very low incidence of COVID. But if you're going to be in a cluster with people and you're worried about getting infected, I would go ahead and wear a mask. And we should be prepared for the fact that if there is a big outbreak in school, we might have to mask kids again because we don't want to shut down schools. We just want to protect them as best we can. Here's a good question. I heard about a new drug targeting COVID itself. What is that? And there's a new drug that Scripps research scientists have been talking about that actually binds to the virus and prevents it from binding to its receptor. It adds a little chemical group on the end of the binding part, receptor binding domain, and makes it so the receptor in the host cell won't accept it. So that's a really interesting new potential drug. It's actually a derivative of a drug that was used for Alzheimer's, but it's being used for this purpose. Is there anything new in the vaccine development for COVID, particularly around inhalants? So there is one inhalable vaccine that was developed by a Chinese biopharmaceutical company it's called CanSino Biologics. It's an aerosol version of their one-shot adenovirus vaccine. I don't know what its efficacy is or if it's any good, but we've talked about it before, but there's a bunch of vaccine trials around aerosols. And this is my favorite. Since deer season has started, should hunters be concerned about COVID transmission from deer carcasses? Should ferret owners be concerned about the mink susceptibility to COVID? I think these animals are closely related. So let me talk about first, you know, I mentioned white-tailed deer, really very highly susceptible, and there's a lot of transmission of COVID between white-tailed deer. They tend to be asymptomatic. There's only one case of a guy in Canada who got COVID apparently from white-tailed deer. Don't ask me how. Don't write anything. But there's no evidence right now that wildlife transmits to humans for COVID. But that said, if you're a hunter and you're out there hunting deer and you actually bag one, it's probably a good idea to wear a mask while you're dressing the game, and be sure you practice good hygiene. I'd wear gloves, wash your hands, all the kinds of things to reduce your exposure to an aerosol that could come from a white-tailed deer. And yes, minks are very susceptible. I assume ferrets are, but I don't know. So anyway, yeah, lots of great questions. I always love getting questions from you. I'll keep sending them in. And have a great weekend, and I can't wait to see you next week.